afternoon. I truly appreciate you taking the time to meet with me today. So, as an avid swimmer for over 8 years, I'm particularly interested in skincare tips, so I'm looking forward to this. So getting into the interview, could you please share some general information like name, years of experience, and specialization?
Sure. Yeah. So my name is Dr. Krystal Massey. I'm a board certified dermatologist and pediatric dermatologist. I practice in Cheyenne, Wyoming. I have 9 years of experience as a dermatologist. And you can find me on Instagram at Dr. Krystal, MD.
Yes. Specific questions about swimming and skin health. How does frequent exposure to chlorinated water impact the skin in general?
Yeah, it's a complicated question. And will try not to get too deep into the basic science of it. But in general, prolonged water contact, chlorination aside, is very irritating to the skin, right? Water, when you're exposed to water for a long time, it weakens the bonds that connect our skin cells together, the keratinocytes, and that allows for more irritants to come in. And then, talking about the chlorine and all the chemicals that are in the pool, now that your skin has been weakened from all of that water contact and more irritants can come in, obviously that can lead to dryness and irritation essentially. With chlorinated pools, the other thing we can get into about, just the skin chemistry in general is we can talk about pH, right? Our skin sort of lives at a very acidic pH of about 4.5. And the reason for this is it allows our skin to be a really good barrier to the exterior world, right? It allows, to be protect from infections. It allows to protect it from irritants. And pools, when chlorinated, it's a very alkaline environment, right? So pools, I think, are like around 7.4-ish. So it's much more alkaline than the typical skin pH. So that basically leads to the loss of, natural oils and makes it so that our skin can't be as good of a barrier to the exterior world.
So, what are common ones that you know that you will face with frequent exposure to chlorine?
Yeah, so I mean, I think the most common for sure is just dryness and irritation. It presents as, like dry, red, itchy skin. That's probably the most common that affects most people. And then, of course, there are a number of pathogens that are water-based that can live in pools and then on like pool decking and in locker rooms and things like that. So like fungal infections, viral infections, things like molluscum and warts.
Yeah.
And there are some sort of less common bacterial infections too that like to live in water. So those are other things that, can affect swimmers more often.
What pre-swim skincare would you recommend or ingredients that you should look for?
Yeah, so I think I guess so going back to a little bit to, the effect of chlorine on the skin, the other thing that happens is when we get in the pool, we have a bunch of organic material that's on our skin, right? We have sweat, mucus,
Yeah.
urine, all sorts of those things. In addition to chlorine makes these chlorinated byproducts that can be even more irritating to the skin. And so for that reason, it's a good idea to rinse off before you get into the pool, especially if you like do a workout or, if you're running or sweating, to get all that organic material or as much as you can off the skin first. So you make less of these sort of chlorinated byproducts. And then, the other thing you can do is add on, an emollient or a moisturizer before you go in the pool to sort of add a protective barrier between your skin and the water. Ingredients like dimethicone or petrolatum, glycerin, these things are really good to sort of make this nice protective barrier over top of the skin.
Yeah. So then when you go into post-swim skincare, would you recommend keeping up with that with hydration, moisturization to
Yeah,
make
for sure. Yeah,
Yeah.
I think the most important thing is again rinsing off right after and rinsing off with lukewarm to cool water. You don't want to go too hot because again, hot water can be very drying also to the skin.
Hmm.
Um, so rinsing off, and then I would usually recommend like an oil-based cleanser to help wash off these chemicals that are on your skin, but also sort of maintain some moisturization while you're cleansing. And then you'll definitely want to pat dry rather than air dry because as uh, water evaporates off the skin, it's also drying. So if you can pat dry. And then, a lot of swimmers like to use toners, which going back to the pH in the skin can be very helpful. So bringing that pH back down to a more acidic pH with a nice hydrating toner can be helpful. And then just adding your moisturizing cream after that.
Yeah. Do you have any like specific moisturizers that you recommend or like brands?
So yeah, moisturizers, the ingredients that you're going to want to look out for in those, or at least, the properties of a good moisturizer, really, a moisturizer should have kind of three main properties. One, it should want to collect water to hydrate the skin. And then two, it should help to kind of fill in the gaps in between the skin cells. And then the third property of a good moisturizer is it should be occlusive, right, to trap moisture in. And so, what draws water in, that's called a humectant. And good examples of those are like glycerin, hyaluronic acid is one, urea is another one. So those draw water into the skin. And then for the second most important property is, filling in all of those gaps. That's like plant oils, like, sunflower oil or coconut oil. Those are good examples of those. And then the barrier function, that last one, a good example of that is like petrolatum, right? Like kind of like a Vaseline like structure, or the dimethicone or things like that to trap all that moisture in.
Yeah. So would like a thicker based moisturizer be more helpful and beneficial?
100%. So the thicker, the better. Creams are definitely better than lotions.
Yeah.
Lotions, they add a lot of the companies will add alcohol to so that it kind of soaks in better and you don't have that, you don't have to rub it in forever.
Yeah.
But ultimately that can actually be a little bit drying. So I typically don't recommend lotions unless you run on the oily side. But creams are a little bit thicker. And then if you want to level up and go even better than creams, an ointment like vehicle, like Vaseline or Aquaphor, CeraVe healing ointment, those ones are even better.
Yeah. Does fragrance come into play when choosing like a moisturizer, a good one? Like,
I mean, I think I definitely see most of my patients have very, very sensitive skin and are eczema prone. And so for them, it's definitely like a no-go on fragrance. But everybody's different and everybody's skin is able to tolerate things a little bit different. I would say for swimmers in particular, you're already sort of breaking down that skin barrier and sort of adding other irritants to the mix with the chlorine. So I typically recommend fragrance free.
okay. How often should a swimmer exfoliate their skin to prevent dryness? Is that
Yeah, good question. I would say probably rarely. So, exfoliation is, adding, either a retinoid or acids to the skin to help turn the skin over a little bit quicker. The problem is they can be quite irritating and drying. And so I think with the frequent chlorination, water contact, especially if you're already dry,
Mhm.
I would probably avoid exfoliation in general.
Yeah, okay, that makes sense. So then what would be signs of over exfoliation so you know what to look for?
Redness, dryness, irritation, stinging, burning, when you're using products, those things, mean that your skin is probably, having some irritation already. So I wouldn't add on another irritant.
So going into like eczema specific questions, how does frequent exposure to chlorinated water affect those people that have eczema?
Yeah, good question. So the water contact in general, and the evaporation of water off the skin when it dries is more drying, right? And eczema patients already have a hard time maintaining their skin barrier, maintaining moisturization. And so their threshold for their eczema flaring is probably even lower than just the general population.
Mhm.
That being said, not all things about chlorine are totally bad, right? Um, I actually have my eczema patients do dilute bleach baths a few times a week, right? And you know, chlorine and bleach are very similar chemically. And if you're following skincare trends online, hypochlorous acid, which is sort of a cousin related to chlorine, is having a big moment in skincare right now. And for good reason. It's great. It's a great product and great ingredient for sort of just toning down inflammation in the skin and helping to kind of kill any bad bacteria that may be causing or triggering eczema like staph or triggering acne. And so, the chlorination part of this is not all totally bad.
Mhm. Yeah, so if you have eczema, is there anything more you should do before getting into the pool rather than like a normal swimmer getting in?
I would say they just need to be a little bit more diligent in that adding that occlusive protective barrier, um, and um, and making sure, the better they can keep their eczema under good control, right? The better their skin barrier is intact. So making sure they're on a good regimen, whether that's, with just topical moisturizers, whether it's with topical steroids or anti-inflammatories, or even being on a systemic agent for their eczema. The more their eczema is under good control, the better their barrier function is of their skin.
Yeah, so that would go for like post swim steps too to like make sure that you're getting in all that
Yeah.
moisture. Yeah.
Yeah, but I would say, yeah, from the emollient perspective, like we talked about, nice, thick, heavy, greasy ointment is going to be better to restore that barrier.
Yeah. So like for skincare products, are there any ingredients that you should avoid if you have eczema or things that you should look for?
Yeah, like you said, fragrance free is super important. The trick with that is you have to make sure it's fragrance free and not unscented. They can trick you with packaging in that regard. Sometimes they'll add fragrances to mask chemical scents that chemicals may have in the formulation. And so just making sure it is fragrance free is super important, or having the word hypoallergenic is good. Um, in general, I typically have my eczema patients avoid really natural products, things with a lot of food-based additives in them and oils and things like that, tend to be more irritating for eczema patients. A brand that I love that I recommend to most of my eczema patients is one called Vanicream. And they make shampoos and conditioners, moisturizers, cleansers, all sorts of good stuff that tend to be very safe for patients with super sensitive skin and eczema.
So for sun protection, because it's the outdoor swim season, I know a lot of swimmers are going outdoors. How would you recommend to like protect skin from UV damage that can happen from outdoor swimming?
Yeah, for sure. So, obviously sunscreen is super important in this. And, everybody's a little bit different on what type of sunscreen they're looking for. Mineral-based ones are going to be better for sensitive skin. So that's active ingredients like zinc oxide and titanium dioxide. That's the stuff that leaves a little bit of a white cast. And those are great for sensitive skin. If you're not super sensitive and can tolerate a chemical sunscreen, that's great too. And then obviously the key is going to be making sure it's water resistant. Usually they'll put a rating on there for water resistance, like 40 minutes or 80 minutes. Obviously, if it will stay on for 80 minutes, it's probably a little bit better. And then, making sure you're reapplying basically. Literally, I tell my patients, set a timer on your phone, 2 hours, you need to be reapplying. Otherwise, you're going to get, active sun exposure, especially if you're, applying your sunscreen early in the day when the sun's not so bad. And then, if you go out say at 8, but then you don't reapply at 10 when the sun is really intense, then you're really going to get burned, right?
Yeah.
And then sun protective clothing, I think is great. Obviously, it's a little bit harder to swim in, but I love the, especially for kids, I love the swim shirts and things like that, so that way you're not even having to think about reapplying and all of that.
Yeah. So when it comes to like looking for a sunscreen, what would be most effective? Like SPF 30, there's different levels of it. So what should you look for when you're going to the store and buying it?
Good question. So the studies show that SPF 30 is sort of the max, is what you need.
Mhm.
That being said, that's with appropriate reapplication and the appropriate amount, right? And so just a good rule of thumb, your entire body needs about a shot glass full of sunscreen, right? And so it's a lot more than probably what people apply. And then again, reapplying at 2 hours. So if you know you're not as diligent at reapplying every 2 hours, and if you probably are like most people and not applying enough, I think going up on the SPF to 50 or 70 is probably a good idea.
Yeah. So for product recommendations, would you recommend any other specific brands? I know you said Vanity Cream. Is there any others that you really love that you would recommend for swimmers?
So I really love CeraVe is one, and they make a great hydrating toner, and they also have a nice oil-based cleanser. Bioderma also has a good oil-based cleanser. Another one that I love is called Elta MD, ELTA MD. They have some great mineral-based options, and kind of some good water-resistant options as well. And then one of my other favorite product lines is La Roche-Posay. They also have a good oil-based cleanser, and their moisturizer is great as well.
Okay, yes. So for dietary recommendations, because I know that that also plays a big role in skin health too, what should we do to like support our skin health?
Yeah, good question. I think making sure you're eating a really well broad, balanced, broad diet, and including a ton of foods with antioxidants, right? So our fruits and vegetables, lots of blueberries, things like that. The antioxidants are going to be best to protecting your skin against the sun, and DNA damage. And then, similar to, there have been some studies in patients who take Accutane for acne, right? Which can be very drying and irritating. There are some data that says if you take an omega-3 fatty acid supplement, that can help with dryness. And so, while not studied specifically in swimmers, I think that translates if you're feeling on the dry side.
Yeah, yeah, yeah. So like with foods like salmon that have like good fatty acids and it'd be good.
Yeah,
Okay, okay, got it.
100%. Yep.
So is there any like other general skincare advice you would give to someone who swims regularly just to end off?
I think the main advice is moisturize, 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 and sun protect if you're outside. But then I think if you're struggling with any issues, see a dermatologist, right? So we can pinpoint the specific issue and make sure it gets addressed, right? Because sometimes, you may be blaming it on the chlorination or the swimming, but it could be something totally else. And so seeing an expert can really help make sure we're targeting, we have the right diagnosis and we're treating it appropriately.
Okay. That's all I had for today. Thank you so much.
Perfect.
All this
Yeah,
advice
you're
was
so
very
welcome.
helpful. Yeah, that's all I had. Any last minute things you would like to add on or?
I don't think so. I think that's great.
Okay, thank you so much.